Welcome everybody to our May Get Well Wednesday, where we're going to focus on pediatric meal ordering and how that empowers patients and saves nurses time. As always, even though this says pediatric meal ordering, the focus is really meal ordering. So whether you're on our, government side of the business or an adult hospital, there's something for everybody as part of this session. So for those of you new to Get Well Wednesdays, we do have this the first Wednesday of every month at 1 p.m. Eastern Standard Time. It's just a 30-minute virtual session. We do rotate topics each month. If you've not signed up for the series, I do encourage you to do so. Or if you've got colleagues that you think could maybe you get something out of some of our sessions, as long as you sign up for the series, we will send you the recording and slides afterwards. So if you can't attend live, you can either find it on the Connection Hub or we will send it to you. This is going to be a really great session. I know it's going to take us till the end of the half hour. So just a few housekeeping things up front. Our upcoming sessions for the summer in June, we will be introducing Get Well Opal, which is our new AI patient assistant that was just debuted at our Get Connected conference. July, we will talk about some of the new Rounds Plus dashboards, reporting capabilities, and enhanced features. So if you do have anyone at your facility that specifically works with Rounds Plus, that will be a great session for them to attend. And then in August, we will have our product team here to talk about Get Well and the smart hospital of the future. So some of those other fun features that we can include in the hospital experience to enhance the patient's stay. Also excited to introduce Program Manager Live Learning. We are starting back with that series. So our first two sessions will be coming soon. Get Well Support 101. This will go into a level set of some of our new processes around our support model with Hello, as well as an overview of our monthly point of care releases and some of our hardware. Folks will be on the phone as well. And then after that, we will have a deeper dive into the Rounds Plus 2025. So an overview of everything we have, as well as the strategic roadmap, which does include Get Well Opal for some automated transcription. So that one will be great as well. So stay tuned, check the Connection Hub when we do have the dates and registrations open for those. So today, I will introduce myself. I'm Misty Avery. I'm the Director of Clinical Services here at Get Well. And then on the line with us is also Samantha Donahue, who is one of our Directors of Customer Success that helps support MUSC. I don't think Maria was able to join us today, but she is one of our great Customer Success Managers that helps support Connecticut Children's. We will be on the line. If you do have any questions or comments, feel free to put those in the chat and we will respond to them as we're able to. And then with that, we actually have two presenters today. We have MUSC and then Connecticut Children. So I will pass it to Brittany and Jeff to introduce themselves.
Hey, I'm Brittany Mivers. I am a nurse by trade, so happy Nurses Week to all the nurses on the phone. I am the program director for digital patient engagement here at MUSC in Charleston. I've been here 17 years, and I have been in this role kind of supporting Get Well and our patient education for the last 2.5 years here at MUSC.
Good afternoon. My name is Jeff Lantini. I'm the Resident Regional Director of Operations for Morrison Healthcare under Compass Group, and I work with Brittany, and I oversee 4 hospitals in downtown Charleston. Children's Hospital is what we're going to be focusing on today. Thank you.
Thank you. And then we will turn it to Sarah, if you want to introduce the Connecticut Children's Group.
Hi, I'm Sarah Visker. I'm an informatics nurse leader here at Connecticut Children's. My title is Manager of Clinical Integration, and I'm also the program manager for Get Well as part of that work. And Ben, do you want to introduce yourself? Oh, we'll kick it to Scott. He might not be here yet. Scott, do you want to introduce yourself?
That's okay. Yeah, my name is Scott Caffrey. I am the director of the Food and Nutrition Department.
And if Ben's able to join us later, he is our lead for the dietitians and over our diet techs.
Fantastic. Just to check, is everybody able to see my screen? Have y'all been able to see it since I got back on? Okay, all right, thanks. All right, so pediatric meal ordering. As you know, with Get Well, one of our biggest and most impactful features is that we have the ability to integrate with some of our other vendors. So whether that's the EHR or something for RTLS, food and nutrition services, even lighting controls in the room. We've got all kinds of ways that we can help enhance that experience and streamline workflows. And some of those are probably our most common integration is with the education and the automated documentation, as well as the medication teaching through Lexicon. We got streamlined communication, so RTLS, our integrated whiteboard, distractions for families, relaxation for patients. But what we're going to focus on today is part of our automated workflow. So taking some things off of our clinical bedside teammates so that they can spend more time focusing on patients and families. And specifically, we are going to cover meal ordering today. So with that, Brittany, I will pass it to you.
Sure. So like I sort of mentioned, this is kind of an overview of MUSC as a health system. We're a very large health system, kind of grown in the last several years to cover over 16 hospitals and have over 2,700 licensed beds. As you can see, lots of accolades and lots of great things going on here as an academic health system. If you want to go to the next slide. Focus a little bit more about Sean Jenkins. So our Sean Jenkins Children's Hospital was opened in February of 2020. Great time to open a hospital right before COVID. So a lot of the features that we were hoping to go live with kind of went live, and then, took a lot of love and care in the last few years to kind of get up and going a little more rapidly. But we have been partners with Get Well since 2005. And then when we moved into this new hospital building, we kind of went a little further with our Get Well partnership, including Get Well Signal iPads outside of the rooms, and we have dual devices with iPads and smart TVs in all of our children's hospital rooms. We'll go next slide. So when we talked about the opportunity to do meal ordering experience, we really looked at it as an additional way to help with patients and families that might want this as a feature. So we really looked at having it be a way to have flexibility. So we didn't have any big issues per se that we were trying to say, hey, we're having big bottlenecking. We just thought it might be able to help our staff there in the kitchen and the call center, but also just add some flexibility. And a big piece of that was kind of rolling it out at the same time that we did BYOD, because we thought that with BYOD giving that parents the ability to maybe order the children's meals from home if they wanted to, or go ahead and kind of get that piece out of the way and out of the hands of the patients and families that were maybe there and weren't able to get it done at the bedside, but could do it at home. We have a lot of great tiles information that we went through and put into our experience. We have meal ordering information, and then we had information on the menus. I think that might be on our next slide. We were able to integrate and have our QR codes for the menu on all of our screens. And so when we were looking at this integration, a lot of the pieces that were really important to us were the ability to make sure that the patients were able to only order and see what they were ordered for a diet. So that was a big win and a big piece that we looked at. And with our partners at Morrison, they went back and forth with us a lot on what was easy for them, but also made sense for the patients. So one of the big pieces for us, we thought, was that including our patient and family advisory council to review the experience before we rolled it out. So we had them look at it several times to say, yeah, no, this doesn't really make sense in the workflows. There were times when we had, for example, ordering a hamburger, but then you had to go back into a different screen just to find ketchup. And so we went through like piece by piece and a lot of work to say what made the most sense and what was the most user-friendly. And it took a lot of, partnership with our Morrison partners to say, yes, this might show up in a different space for the kitchen staff. What does that look like? How will their workflows adjust? And so a lot of partnering and a lot of mutual understanding of we're all here for the patients and what makes the most sense for them. We have reminders that send to the patients prior to the meal cutoff time to just remind them that if they want to order their meals this way, this is how you do it. One of our big feedback pieces was that we did see when they were adding it to a cart, it made them feel like they might have to pay for it. So we kind of just got the verbiage from the patient and families that they thought order sounded a little more easy and not as confusing about making sure they didn't feel like they had to pay for it. You can choose what time they want it delivered to them to, as you see on the screen here. So that was a big win.
And I know you have it in Spanish as
Yeah.
well, which
So
was
we have our menus in Spanish. We don't have the ordering quite yet in Spanish, but I think one of the big pieces in the information we get feedback wise is that with the pictures, it's a lot more simpler for them to at least go through it and kind of see what we have to offer, because we took a lot of work. Jeff took a lot of work in taking pictures and making sure that they were accurate on there as well.
fantastic.
And this is just a quick screenshot. We can definitely get these to y'all if you want, just to be able to use, but we've made a FAQ guide on how to order them from the TV, step by step, kind of the information, and then some of the frequently asked questions that we got when we were talking about rolling it out. One of the big ones we still get, and I'm sure that's the question, is if there's limits for how many meals a patient can order. You know, sometimes kiddos can get excited in there when they're on the iPad and just add one of everything. So we've got a system in place, and Jeff, I don't know if you want to speak to that, just if that happens, what y'all as a team do.
Now, if that happens, what we do is we go into the operator center and make a call to the room to find out, let them know that their meal consists of, you know, 1 entree, 2 sides, whatever it might be. We will let them go up to 2 meals, and then we just talk them through the menu and find out what they really want so that it stays within the realm of what a tray is supposed to look like for their diet.
Perfect. And if you want to speak to this.
Yeah, so with the ordering on the Get Well network, it has really impacted the savings for our operators. We figure that a call with an operator can take up to 5 minutes, but if you're using bedside where you're going into the room and taking an order, this eliminates a lot of time that is spent from the patient dining associate or the hostess to be in the room and getting an order from a patient. What we have found is about 15% of our patients are using this right now, and it is really helpful. And it's when the ticket comes out in the kitchen, it does say ordered by patient on it, so that we know that it's a patient order, and we have to look at the ticket a little more closely to see if they've added any extra items in there that may or may not go with that meal, or try to figure out from the patient's point of view what they were ordering. You know, they may order a burger, then they order the bread, then they order the cheese. So we know to put the cheese on the burger and then on the type of bread. So it's pretty simple, and it's worked out really well. And we haven't had but just a couple issues with people ordering, you know, a ticket that is 3 feet long, you know, with everything on there. We had a gentleman the other day ordered, or a young man ordered 4 meals and 12 snacks, 4 apples, and a bunch of drinks. And, you know, we went up and talked to him and got it straightened out as to what his family needed. So it's a great program. I think one of the best items is the BYOD, bring your own device. That has just really helped, because moms that are working or grandmas that are working can order for the patient right off of their device. And I think that's one of the coolest programs. And it still tells us that the patient ordered the food, but it might be that mom wants them to eat a healthier meal than what the child would order themselves. So I really like that program.
Yeah, that's fantastic. BYOD is so helpful in those situations where the caregiver may not be at the bedside, you know, to help with things such as meal ordering or peeking at the whiteboard. I love that you have 2,478 estimated hours saved. That is tremendous. So good job there. And then we had some really good feedback come in. So Brittany, I'll let you share that.
Yeah, definitely. Like we said earlier, you know, it's really nice for those Spanish speaking families because it does save time for them as well. They'd usually have to get an interpreter over the phone if they're able to navigate it pretty well with looking at the photos and being able to add it. That's been a huge win. And then definitely the specialty diets, you know, if there's somebody that's sees a menu and they're still not sure what that means, it's just nice for them to have only the things that they're supposed to have show up on that menu for them. So once that comes over from Epic, it's showing, hey, if this is a modified diet for whatever reason, only those items will populate. So really excited about that. We're rolling this out, hopefully, fingers crossed, to our adult hospitals by the end of this year. We're hopeful for that with BYOD live over there too. Same thing. If there's, elderly family members and maybe their sons or daughters or grandchildren are able to order it for them, and just being able to take that extra special care.
Fantastic.
Yeah.
All right, so we will turn it over to Connecticut Children's. Just to reiterate, if you do have any questions or comments, feel free to put those in the chat. We'll be monitoring those. And we can answer them in the chat, or if we do have time at the end for Q&A, I can help you come off of mute to ask those questions. So Sarah, I will turn it to you.
Hi, I'm Sarah. So coming from Connecticut Children's, we are Connecticut's only hospital dedicated just for kids, and we are a freestanding children's hospital. So that's all we do is kids all day, every day. We're currently at just over 200 inpatient beds, but we are ever growing, and we have an ever sprawling ambulatory footprint that goes up into Western New York and Southern Massachusetts. For our awards, just notably ones to see there is, especially with Nurses Week, we are 2-time Magnet designated, so a great place to work for nurses, and we are also chimed most wired. We can go to the next slide. And coming this December, we will have a new patient tower. So in this new patient tower, first thing going live will be 25 of a 50-bed NICU. And also notably on here to this discussion is a new kitchen and dining space. Current state, Scott and his team, what they do, and it's literally not much bigger than a closet right now in our food prep area. It's amazing. So what they're going to be able to do with this new state-of-the-art kitchen, I can't even imagine. So just for some level setting here, we have an actual food prep space. When our hospital opened 28 years ago, Hartford Healthcare, which is across the street, would deliver meals through the tunnel. At some point, they stopped doing that. And then we had this little closet that got turned to a food prep space. And they provide all the meals for all that 200 inpatients out of that one very small room. And they have it down to a science in there. Go to the next slide. So unlike what Brittany was saying, we had a lot of room for improvement. This was not an addition. Up until this point, nursing would take the meals. So the provider would order what kind of diet they had. We had paper menus for all of those diets. Those paper menus would then be distributed by the nurses. The families would fill them out, or the nurse would help them fill it out. They would bring it back to the unit secretary, and the unit secretary would use a fax machine to fax them. It's embarrassing to even say that. This is in 2019 and into 2020, we were still faxing menus. And just kind of a funny story with this, right? In the late summer of 2020, I had to do an inpatient stay just really shortly with my son, and he was putting in his meal, and he knew that I Get Well was part of what I did, and he heard about this project happening, and we were in the testing phase, but not live yet, and his menu got lost, and he didn't get his pancakes in the morning. So that was devastation. And he was like, "Mom, you said you were fixing this. Why isn't it going yet?" So it put some extra oomph in to get this project done. You can go to the next slide. So this is just a little look at what Get Well Network meal ordering looks like. Again, we went live in September 2020. So you can order today's meals and the next day's meals. And we also went live in subsequent years with BYOD, so it's live on both the TV and BYOD. And the next slide. For our implementation plan, we went live with patients on a regular diet and food allergies, and then through the upcoming months, we were able to add 18 specialty diets. So our thought is for these 18 specialty diets, families can do it on their own. Any other specialty diets, we prefer to have a diet tech come and have that conversation and do that education with the family and help them build their meals. We don't have the problem with ordering. I'll talk a little bit about in my next slide, just not quite yet, about some of the interfaces that we have, but they're cut off. They get a limit, and then for example, for a high or a low sodium diet, if you reach your sodium limit, you also get cut off that you can't order anymore. And we went live on the TV, and then when we went live with BYOD, it was included with BYOD. we decided for the very first week just to open on one unit, just to make sure that we could work out any of the kinks with the workflow and make sure that it went with the tickets printing correctly, the delivery was going correctly, and everything went really well. So after 1 week, we went to the all other inpatient areas. So we have our 3 med-surg units, our PICU, and our ED live with meal ordering. And the goal of this project was to offload non-clinical tasks from nursing, because at the time, nursing was having to complete these tasks, and to provide our families with the best experience possible. So you can go to the next slide. So this is just a very high level view of what the interface looks like. The diet is ordered in Epic. It from Epic goes to Get Well and to Seaboard. And Seaboard then displays what is available in that diet into Get Well. And like I said, the family can pick. You can set limits in Seaboard so that they can't order like more than, I think we set ours at 2 entrees and maybe it's 2 or 3 side dishes. And that way they're able to get their limits on their meal. And then Seaboard will print restaurant style tickets in our kitchen. So you can go to the next slide. This is what one of the tickets looks like. So if you can see here, they in the ticket, probably about halfway down, even like our safety items like no sharps. This is a patient who could not have sharps on their trays. We can highlight that, and whenever these get printed out, the kitchen team will review this and like highlight or circle any notable things that need to be made sure of that we get them correct. So we do not, because of our very limited space at this time, we don't have like room service. We have like tray pass times. So we have 2 printings at each meal of when all of the meals that were done into Get Well Network will print at one time, and then the rest of them that come in print at the second time. And then we have so for example, for breakfast at 8:15, 8:16 comes around. Anyone who didn't put a meal order in yet, a list will go to the diet techs, and the diet techs can then follow up with their iPads to collect those meals. And then 10 a.m. is when the meal closes. Can go to the next slide. And with Scott's team, it was really important to, from a customer experience standpoint, to just really show what the food actually looks like with portion sizes. So like Brittany and her team, they take pictures. They have a setup of a white background here and a picture. And then Misty was kind enough to provide us with step-by-step instructions on how to upload them into Get Well Network. And so for our efficiency that we saved with this is very similar to what MSU has said. So for March, we had 830 meals placed by 198 patients. And this represented 12.5% of our total meal ordering. But a real win for this was nursing was taking out of this process entirely. And we were allowing our diet techs to operate to the top of their license to, in the top of their scope, to be able to get the right care to the patient by the right person at the right time. And I think we're it. So if we have any questions, I helped to get it onto the TV, but Scott and Ben are the ones who make it happen in real life every day. So I invited them to come in case there's any questions on how we do it operationally.
Yeah, absolutely. And again, you can put questions in the chat, or if you raise your hand, I'll try to take you off of mute. We just have a few minutes left. There will be a survey that goes out afterwards. If you do have questions we don't get to, feel free to put them in that survey and we will follow up with you, I promise. So one question that came in for defined delivery times: how were you able to set up the 1 to 2 times in Get Well? Do those times come across from Get Well into your meal program? And we do have room service, but only have 1 to 2 available Get Well times to come across the interface.
Yeah, I should be able to answer that question in terms of the times. So we use Seaboard at Connecticut Children's specifically, and we're able to assign printing times for the different meal and snack periods. So it just connects directly with Get Well Network in terms of how those two communicate between the printers. So it just follows those options. So when our diet techs and tray passers are collecting menus, they actually have the option to queue those meal periods at those times. And I think through the Get Well Network, they just automatically come through.
Perfect. Thank you. Another question, do either have the ability for families to order guest trays, and how would they pay for those? This is a very common question that we get.
Misty and I have talked about this so much. Missy's probably sick of hearing it. So we do not, but when I was at Get Connected, one population in particular is mothers who are breastfeeding. We do provide meals for them. And currently, like our diet techs or the nurses help to coordinate those meals. And we would love to be able to do it through Get Well Network. But because those mothers are not patients of ours, they don't get set up through the interface. But I heard somebody is doing it when I was at the Get Connected conference. So my call was going to be to Maria to let her know I heard somebody was doing it. So let's circle back on that.
Awesome.
Yeah, same thing here. We have the information on a tile that gives the information about guest trays and that how important it is that we would love to be able to supply, but it's easiest to call down and be able to pay for that over the phone that way. But same thing too with the NICU space. We've had a lot of talk about, if there's an integration of if they have, breastfeeding diet in Epic, can that trigger too? Because even outside of our NICU, if we have small babies on even a med surg floor, that there's still a breastfeeding mom, then those families should still get a guest meal. So more to come. We're all excited about that, even the panelists. So.
Fantastic. We got time for maybe one more question. Do you have every food and beverage item on Get Well? And if not, can patients reach out and ask?
We do. We put every single item that was available through our menus on there, and even added a couple of specialty items like cheese sticks and Go-Gurts. The items that are available for the children is it's tremendous amount of food that they can go, because we are measured on, do we provide food that my child likes? That's one of our measurements, and we are up in the 70th, 90th percentile. It varies, but we get the kids whatever they want.
Just to add on to that from the Get Well side, we are integrated with a variety of dietary systems. So as new menu items are added on the dietary system side, those would automatically pull through to Get Well and be updated in the display on the patient's device.
All right. Well, thank you, everybody. Looks like we've got about 2 minutes. Again, apologies for the technical difficulties. I'm not sure why my internet decided to go out 1 minute before this presentation started. So thanks for your patience and hanging in there with me. If we didn't get to a question or you think of one afterwards, feel free to just reach out to us. We will have that survey that goes to you once we close this webinar. Feel free to put any questions in there, and I will contact your customer success team and they will reach back out to you. Recordings of this and all Get Well Wednesdays will be posted in the Get Well Connection Hub. If you don't have a Connection Hub account, I highly recommend you get one. That's kind of our one-stop shop for all things Get Well. If you tuned in last month, you saw my presentation about that. So we will send the slides and the recording once it's edited out to everybody on this call. And feel free to promote Get Well Wednesdays with other colleagues at your facility. There's something for everybody coming up. So it's just a great way to touch base and hear what our clients are doing. All right, we're at time. Thank you so much, everybody. We'll be in touch.
Thank you.
Thank you.